Welcome to Town Hall TV. This is our new programme where we'll focus on the activities of the Town Hall Group, its staff, the clinical excellence and the work it does in the community. My name is Nigel Allman. I'm the Managing Partner of Ashton Consulting Board and I'm also a Non-Exec Director of Town Hall Group. I'm absolutely delighted that the first interview is with Rachel Dilley. Welcome, Rachel.
Thank you, Nigel.
Rachel is the real tour de force of the business and she's the Chief Operating Officer. And we're here to learn a little bit more about Town Hall Group, what it represents, and also to talk to Rachel about her career and also how she leads the business and leads the team here at Town Hall Group. So without further ado, Rachel, just tell me a little bit about Town Hall Group and what it comprises.
So Town Hall Group is our vision and our passion. It's been building up for a couple of years as we've continued to grow. It consists of one private practice, Town Hall Dental, an NHS practice, Beechwood Dental, a dental supplies company, JLM Supplies, conference centre, the room at Town Hall, sports dentistry, the Breathe Clinic, and our charities Focus for Hope and Town Hall Foundation and Focus for Success.
So clearly you didn't start with all of those businesses. So how did it all start?
I fell into dentistry, literally, in the dental chair. So I wanted to be a paediatric nurse. That was what my vision was going to be. I went to for a dental appointment when I was 17 and came out with a job. So I started on my 18th birthday. Absolutely loved it. Absolutely loved it. I've always been really career-minded on what I wanted to achieve. So when I got to be a registered nurse, I then went to head nurse. When I was head nurse, I met our principal, Dr. Imran Rangzeb, and wanted to be practice manager. So I became his practice manager when he bought one private practice. And through my career, I've become director. I'm very proud of my team, of the businesses and what we've achieved.
What is it that really resonates with you about the business? What makes you want to get up in the morning and come to work? It's the team that I call family. Okay. So I'm so proud every time I walk through the doors of Town Hall Dental. My office is on the top floor. We have just such a fantastic team. We all have the same ethos and the same drive to deliver the best patient care. And I think when everybody's got that vision, it gives a different aspect of working together and becoming a family. And that is what is different about Town Hall Dental. And as a group as well, I've got behind the scenes team that work with me and they become family as well. So family in the sense of family business is important to the organisation. How does that manifest in terms of the community? It's a privilege to be able to look after the community of Brighouse and Calderdale. Through our business, I'm an avid supporter of corporate social responsibility. Our businesses donate a lot of time. We've got our own charity called Town Hall Foundation, which I'm really proud of. A lot of our staff are trustees. There's a lot of people that can't get access to a dentist. We work with predominantly the homeless and ex-homeless, a lot of people in pain that haven't seen a dentist. And through our volunteer work and through our skills as dental care professionals, then we basically are able to provide dental treatment, but the care that they need as well. It's an incredible story. And in terms of the community and then the clinical excellence that the business brings, how does that dovetail? So tell me a little bit more about the foundation. The Town Hall Foundation is something that Imran and I have always wanted to achieve. And when the time was right and we'd achieved what we wanted within practice, we wanted to take that outside the practice into the community and give back to those people. And it seemed fitting that we used our skills in dentistry. So Town Hall Foundation has two parts to it.
oral health education within schools and also for adults with learning disabilities. And then we have the second side of the charity, which deals with looking at people that can't access dental care through poverty, through drug addiction, through alcoholism, through physical abuse, through sexual abuse. The team are absolutely fantastic, and each person, each individual patient gets their own care plan because not everybody is the same. And I think that's what's different about Town Hall Foundation is the care that we give and the unique opportunities that we can provide to that patient. And again, you treat them like your family, your brother, your sister, your mum, your dad. That's what Town Hall Dental and Beechwood Dental is all about.
It's certainly something that resonated with me when we first spoke about my own involvement in the business. But just turning to you for a moment, you're a role model in terms of what you do as a female leader. Just talk to me about what leadership means to you.
Oh, leadership to me is I'm very passionate and I'm very driven and I know what I want to achieve. But I also am not complacent and I know that I can't achieve those things without having the right team. You have to have the right team because a good leader is only as good as the people that you've got working with you. And I think it's that makes me a good leader. In the passion that I have, the team can see it and that makes them want to be passionate as well. Each person within my team has their own individual personal development plan. So I encourage education. I encourage them to do as much as possible and learn as much as possible because obviously knowledge is power, and if you can have the knowledge, then we can take the practice forward. You know, we are and have lots of innovation, clinical innovation within the practice, and I really encourage that among the team.
I understand that you've got a very good, strong relationship with Leeds United. Just tell me a little bit about that from the clinical side.
I'm the key point of contact for Leeds United. I've been working with the head of medical for the past 2 years. It's a fantastic relationship that we've got. I'm really excited to be looking after the players. The players, you know, have become our friends. But the care is still the same that we give to our existing patients. Obviously, with the players, we need to be on hand to provide 24-hour emergency care, which we do. But again, we provide that for all our patients. And also our strong community support that we have. Also, we work with their foundation as well. So it's really nice that we're both interlinked in that community spirit.
Rachel, it's been an absolute pleasure to talk to you. All too brief, but I wish you well and look forward to seeing the success of the group.
Thank you very much, Nigel.